Hello and welcome to Woodbridge, the best town around. My name is John McCormick. I'm the mayor of this great town. And we're here today to welcome to Woodbridge the United States Department of Health and Human Services SRA Enrollment Assistance Center. I don't know what this all means. I'm going to turn it over to Jackie Cornell. She's going to explain it. But what's important is that the federal government has chosen Woodbridge as a site for this operation, which I think is great. It's another service we offer to our residents. The fact that it's local for people in Woodbridge is terrific to have this resource right here to get to whenever they need to talk to the federal government about insurance. So we're very, very proud that they've chosen Woodbridge. Jackie, can you take over and say a few words about what this all means?
Absolutely. Thank you so much, Mayor. Thanks for having us. I'm Jackie Cornell. I'm the Regional Director for Region 2. I cover New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands for the Department of Health and Human Services. And we're here in Woodbridge today, but we've been busy all over the state and all over the country for the last few days because we're now in the 4th open enrollment period for the Affordable Care Act. So thanks to the ACA, 20 million Americans now have health coverage. Right here in New Jersey, thanks to Governor Christie expanding Medicaid and to our work to enroll people in marketplace plans, we have close to 750,000, so 750,000 New Jerseyans now have health coverage because of the Affordable Care Act. And folks can come into centers just like this. This is one of 3 storefront offices that we're running here in New Jersey. We have one in Clifton, another one in Union City up in Hudson County, and this one right here in Woodbridge. You can come in for free assistance. We have a variety of languages that are spoken to see what options are available to you. It's important to know, I know that it has been brought up in the news a lot recently, that premiums are rising. But here in New Jersey, we've seen a very slight increase of only a 5% increase in premiums. And in fact, most New Jerseyans, 53% of them, can receive coverage for $75 a month or less. And if you expand it to $100, we go up into the high 60s of a percent of New Jerseyans can receive coverage for $100 a month. So when you start to think of the cost of a cell phone bill and the cost of health insurance, these two things are pretty equal. We want to make sure that New Jerseyans know that there are still 2 issuers that have long histories of working here in the state, and there are on average 19 plans that consumers can pick from. So there's a lot of options, there's a lot of affordability, and there's a lot of great benefits to being enrolled and being covered. So we are so fortunate to have with us one of the architects of the Affordable Care Act, somebody who has long been a champion for families, for New Jersey families, for the health care of all Americans, right here with us, Congressman Frank Pallone. So I want to give him the floor to say a few words. Thank you so much.
Thank you, Jackie. First, let me thank Mayor McCormick. He's always promoting Woodbridge, and we're always proud of the fact that that we can do things in Woodbridge that make a difference for people's lives, and that's what John McCormick is all about. And I also want to thank Jackie. We know, I guess, a few years ago, myself and some of the other members of Congress asked you to set up some enrollment centers in the northern part of the state. I actually think of Woodbridge as the central part of the state, but I guess from Middlesex north, right, because we felt that we needed to do more in terms of enrollment. And so now for several years, we've had an enrollment center either in Woodbridge. Well, you told me originally Edison, then
Edison
Woodbridge,
to Woodbridge, Edison to
then
Woodbridge.
Edison, and now in Woodbridge.
But now they told me they're staying here forever.
Oh, okay. Well, that makes sense. Woodbridge forever. But in any case, so I mean, it's important that we have these centers because we want to make sure more and more people are covered. And as Jackie said, I mean, the success of the Affordable Care Act is primarily and that so many more people are covered. I think now, before the ACA, it was over 20% of New Jerseyans did not have insurance. Now it's actually less than 10%. So that is a huge success. The other thing that I wanted to point out, too, is that, you know, as Jackie mentioned, Governor Christie did expand Medicaid in the state. And so a lot of people, you know, may come here and also find out that they're eligible for Medicaid. And if they are, then they sign them up for Medicaid as well. And even though we talk about the marketplace, that's what it's all about here, people signing up for the marketplace, I really want to stress again how the ACA has made a difference to everyone in terms of, you know, those who, majority of people who still get their insurance through their employer, the senior citizens and the disabled to get through Medicare as well as Medicaid, because everyone has benefited. You know, we basically now have a very robust benefit package that you have to have across the board. So you have a good benefit package regardless of which type of plan that you choose. And, you know, so when she's talking $100 or, you know, per month, we're talking about not $100 for some skeletal plan with just catastrophic coverage. We're talking about a plan that provides pretty much, you know, most of what you would want or you would expect in a healthcare plan. And that's true whether you're getting your insurance through your employer or, you know, obviously if you're getting under Medicaid or Medicare as well. And then we eliminated all these discriminatory practices where you know, couldn't buy insurance, or it was really expensive if you had a pre-existing condition like cancer. Or if you have your kids, they can stay on your policy till the age of 26. And even with Medicare for seniors, we've got free preventative care, no co-pays. We're closing the donut hole for prescription drugs. We've actually improved the trust fund for 12 more years, you know, before, you know, that the trust fund is shored up. So I just want to stress all these things. Now, just one point that Jackie made about the premiums. You know, it is true the premiums are going up, but the idea always was that we were going to try to stabilize premiums over the long run. And before the ACA, every year the premiums were double digit. Now, in some places they are, but not in New Jersey. In New Jersey, as Jackie said, it's only, you know, I don't want to say only, but it's about 5%, which, you know, is pretty stable, in my opinion, considering what it was, you know, years before the ACA. But I also want to stress from a practical point of view, people can come here not just to sign up who were not enrolled, but also to look and shop for plans, because that was part of the ACA's goal as well, is that you would look at different plans. There would be some competition. It's not as much competition as we'd like, but we're still working on that. But, you know, you come here and you decide that you want a different plan. You look at the different options. And I think oftentimes people need help with that. I know personally, I don't like to go online and decide what plan I'm going to get. I like to talk to somebody. So that's the great thing about this place, is if you don't want to go online, you can come here and they will explain to you what the different plans are and help you make an educated consumer decision. So that's, you know, it's not just for people who haven't enrolled. It's for people who want to look and shop around, which is part of what we're trying to accomplish. So thanks again. Thank you both.
Thank you, Congressman. I just want to thank Congressman for being here. He's always been a great advocate for Woodbridge Township. I've been mayor for 10 years in a few weeks, and Congressman Pallone's been there the whole time, and he's always looking out for Woodbridge and always taking care of our constituents here. I do want to say the location. We are on Route 1 North right now, behind the Pearl Vision Center, which is just past Woodbridge Center, and there's a gas station out front. So when you're coming down Route 1 from Edison, you go through the light on Woodbridge Center Drive and Gill Lane, and then get to the right. And when you see Pearl Vision, it's not just Pearl Vision, it's also this operation here. So if you miss it, you got to go around. So pay attention. And when you hit Woodbridge Center, you know it's time to move over and get ready and follow the signs for Pearl. And we have signage out there too also, but follow Pearl Vision right after the gas station, which is right after Woodbridge Center. And now I'd like to present Omar Borges, who is the site manager here. I'm sorry?
Omar Bonet.
Bonet? Okay. Well, I'm not getting your name wrong, man. I think he could break me. So I'd like to present you with the mayor's proclamation here to hang on the wall. Welcome you to Woodbridge, November 3rd, 2006, at the grand opening and ribbon cutting. Congratulations.
Thank you, man.
And if our town government can ever help you in any way, or the town, you know, the building department or whoever, our social services people, we'd love to develop that relationship so we know exactly what you have. You know what we do. We can cross-reference and help our people. So that'd be great.
Fantastic.
So thank you very much. Take a picture here of. And you want to say a few words?
Just want to say thank you so much for the mayor, Congressman, Jackie, for coming down. We're ready to assist every one of you. Please come with your social security number, your government documents, and estimation of how much you're going to make for 2017. And all our assistants are here to help you free of charge. All right? Thank you very much.
Terrific. Thank you very much.